Well, hello, my name is Solomon Beckford. Um, I am going to be presenting about doctor-patient relationships and how they are a critical dilemma um, in patients who can't communicate or won't communicate to their doctor, and how this can hinder their care and even the doctor's capacity to help as a result of their current illness or situation. And I had a few questions in mind about this regarding about if the patient is confronted with a situation of this caliber, how will the doctor be able to help, and how would the patient not be able to think the doctor is a quote unquote mind reader or a person who already knows what is happening to the patient, when obviously we already know that that doesn't really happen always. So, and how this can affect even doctor patient confidentiality as well. Okay, pros and cons of the physical dilemmas of a patient while communicating. Studies show that patients who communicate more with their physicians are better are will have better outcomes, which is definitely true. And I've personally seen this firsthand, with family members, with friends, and all that stuff. And even if the patient is not necessarily able to speak, even if they're just trying to reach out, or even if they try to reach out to a family member, something like that, it will still help, of course. But now a con of them having a physical dilemma while them trying to communicate to the patient or to a loved one or to anybody is something that happened during the COVID pandemic, where due to a lot of the patients having an ability to breathe on their own, they had to have a procedure named the tracheotomy done on them. And this procedure is where they put a tube down a patient's throat to be able to make them breathe, of course. And due to this procedure, many family members discontinued care of their loved ones, even though they had COVID, because of a lack of communication. And that is definitely a hindrance on the family, especially the patient themselves, and even the doctors and healthcare staff. Okay, now many misconceptions about patient to doctor communication. The many reasons for misconception among patients arise are because doctors supposedly have intuitive understandings of patient concerns. But however, this is not true. In some cases, for example, before a doctor must administer a life-saving treatment, they must obtain a consent from the patient. So, meaning, with all those words right there, meaning that the patient is basically thinking that like the doctor can think for them and can do stuff for them, even though they're incapacitated to be able to say anything. No, it's not necessarily how that works. And due to this happening, the family of the patient and even the patient themselves, to the best of their ability, they don't communicate. And as a result, that can hinder their care. And as I said again, that can hinder the care that the healthcare team will give to the patient, of course. Now, here you might have noticed that I put a little tiny skit here saying, "Hey." So it's the doctor, of course, saying, "Hey," and then he's saying, "You're my patient," and the patient's kind of wondering, why did you take care of me so much? And now this is kind of showing like what the patients expect in a way, but that isn't really the case, because, as we already know, doctor isn't a mind reader in certain cases. Okay, now more information about how impairment can affect communication. In a 2022 study conducted by AJO, American Journal of Otolaryngology, explored how altered healthcare delivery during the COVID pandemic affects patients with the tracheotomy procedure done. After the study was conducted, 199 out of the 268 individuals, which is 71.3%, responded to the survey given after the study, stating that though it will help the patients in their ability to breathe, it will limit the doctor's power to do his or her work, and even limit the patient to even speak and do their job as well. Because even though the patient might be incapacitated, they do have a job, and that is to try to the best of their ability, to be able to speak to the doctor in a way that both parties can understand. So my final thoughts. There are many hurdles requiring us to think deeper and share our differences so we can be more transparent and give the best optimum care to patients, to our future patients, and to better understand their needs and the needs of any other patients after our first patients, and even to better communicate with them and to show them that we actually care, that we're actually there for them. So thank you, God bless you, and I hope you guys all have a wonderful winter break. Thank you.